Bismillahirrahmanirrahim. Uh, and quote for the day is whoever does an atom's weight of good, we will see it. This is an ayah from Surah Al-Zalzala. The topic for today's presentation is Universal Health Coverage UHC. I am Dr. Ayesha, AminPGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of my supervisor and teacher, Professor Dr. Saira Afzal, who is the Dean of IPH Lahore. The learning outline for today's presentation would be introduction, importance and components of universal healthcare, global status of UHC, UHC in Pakistan, WHO response about UHC in Pakistan, strategies and challenges to achieve universal health coverage in Pakistan, and multiple choice questions at the end. Learning outcome. By the end of these presentations, the participant would be able to describe about importance, components of UHC, universal health coverage in Pakistan, along with the strategies and challenges to achieve universal health care, and to be able to answer the multiple choice questions. Introduction. Universal health coverage or UHC means that all individuals and communities can access quality health services whenever they need them without facing financial difficulties. It includes health promotion and disease prevention, diagnosis and treatment, rehabilitation services, and palliative and long-term care. UHC focuses on availability, accessibility, affordability, and quality of healthcare. According to the World Health Organization, UHC ensures that people receive needed services of sufficient quality while being protected from financial risk. Importance of universal health coverage. It improves population health by ensuring early diagnosis, prevention, and proper treatment, leading to reduced illness and mortality. It reduces health inequalities. It provides equal access to healthcare for rich and poor, urban and rural, and to the vulnerable groups. It supports economic growth. A healthy population is more productive, reduces work loss, and contribute to a national development. It enhances social protection, protects families from high medical expenses, and prevents poverty due to illness, and it promotes human dignity. It treats healthcare as a basic right and ensures respectful, fair, and quality treatment for all. Core principle of UHC. The main principle of UHC is that everyone should get the care they needed without financial hardship. The principle highlight two key ideas. The first is access to care, which states that people should receive healthcare based on need, not ability to pay, and no one should be denied treatment because of poverty. And the second idea is financial protection. Medical costs should not force families into debt. Health expenses should not lead to selling assets or taking loans, and out of pocket payments should be minimized. So, universal health coverage protects both health and income. The components of universal health coverage. The universal health coverage is broadly studied under three components. The first one is equity in access, quality healthcare services, and third is financial risk protection. We will look into the details of every component. Again, the dimensions of universal health coverage are three. That is the population, who is covered, the cost covered, how much is paid, and the service covered, what is covered in those services. The dimensions of universal health coverage is demonstrated best by a coverage cube. Universal health coverage is often explained using a coverage cube, which shows how health system expand coverage in three directions. What are those three directions? The first is how who is covered, that is population which is covered, the services which are covered, and the cost coverage, how much the population has to pay. So this is the coverage cube. As you can see in the diagram, there are three axes. The horizontal x-axis has population axis, who is covered. Then there are service axis, in which we got to know which services are covered. And then there are cost axis, which shows that the proportion of direct cost covered from people funded. And the center of this is it involves all the funding mechanism created from pool funds, which reduces the out of pocket payments and cost sharing. And it include all the new services and extend coverage for health services to more people. So the first component is population covered or who is covered. This dimension refers to how many people are included in the health system. It focuses on covering the entire population, including poor, rural, and marginalized group, ensuring migrants, elderly, women, and children are not excluded. The goal of this component is to shift the care from selected groups to everyone. The second component is service covered. What is covered? This dimension refers to which health services are included in the universal health package. It includes preventive services like vaccination and screening, maternal and child health care, of infectious and chronic diseases, emergency services, and mental health care. Again, the goal of this component is to shift care from limited services to a comprehensive type of care. And the third component is cost coverage, how much is paid. This dimension refers to how much of the cost is paid by the health system and how much is paid by the patient. It focuses on reducing the out-of-pocket spending, increasing government funding, expanding insurance coverage, and providing free or subsidized services. The goal of this component is to shift care from high patient payment to strong financial protection to the patients. The next is universal health coverage and sustainable developmental goals. Universal health coverage is also a core part of the sustainable developmental goals, especially under the SDG 3, which state good health and well-being. So SDG 3 aims to ensure healthy lives and promote well-being for all at all ages. And UHC is directly included in the target 3.8 of SDG 3, which state achieve universal health coverage, including financial protection and access to quality health care. So universal health coverage is essential for achieving the SDG 3. The universal health coverage it also supports other sustainable developmental goals like SDG 1, which states no poverty, and it includes prevents medical poverty and reduces health spending shocks. SDG 4 for quality education, healthy children attend school and improves learning ability. SDG 5 of gender equality, it improves maternal health and protects women's right. SDG 10 reduce inequalities, ensure equal health care, and bridges urban and rural gap. SDG 10, which states decent work and economic growth to make workforce productive and reduce risk, sick leaves and gaps. And SDG 16, a strong institution, strengthens health system and improves governance. So UHC is directly linked to SDG 3, while it directly or indirectly support rest of the SDGs. Before going into the detail of the scores and how what is the trend or impact of UHC over the years, first we will want to know what Universal Health Coverage Service Coverage Index, because UHC is measured in terms of service coverage index. So Universal Health Coverage Service Coverage Index is a measured on a scale from 0, that shows the worst score, to the 100, which shows the best score, based on the average coverage of essential services, which include reproductive, maternal, newborn, and child health, infectious diseases, non-communicable diseases, and service capacity and access. The score is calculated for all of these, and then the coverage index is calculated. So in this diagram, you can see that for reproductive and maternal and child health, there are 4 indicators like family planning, antenatal care, DTP3 immunization, and care seeking for suspected pneumonia. For infectious diseases, there are again 4 indicators: TB treatment, HIV therapy, insecticide treated nets, and basic sanitation or wash. For non-communicable diseases, non-elevated blood pressure, mean fasting blood glucose, and tobacco, non-tobacco use. And for service capacity and access, hospital bed density, health workforce density, and IHR core capacity index. So on the right side, you can see that all the indicators of RM and CH, they are multiplied, and then the score is calculated. Then same is go for ID, then non-communicable disease, and for the service capacity. And in the UHC service coverage index is calculated by multiplying all of these components, and then the average score is came out. So, the global status of universal health coverage. At the current pace, the world is not on track to achieve the universal health coverage, despite earlier gains in expanding health services access and reducing financial hardship since 2000. Progress has slowed since 2015. The Universal Health Service Coverage Index increased from 54 to 71 points between 2000 and 2023. However, for the period of 2015 to 2023, progress dropped to one third of the annualized rate compared to pre 2015 gains. The proportion of population not covered by essential health services decreased by about 20% between 2000 and 2023, indicating that in 2023, about 4.6 billion people were not fully covered. These are all the stats from World Health Organization. I have given the reference in the end. In 2022, 2.1 billion people faced financial hardship, including 1.6 billion people living in the poverty or pushed deeper into it due to the out-of-pocket health expenses. This equates to 26% of the population and a drop of from 34% in 2000. All WHO regions saw progress in service coverage, while half, like Africa, Southeast Asia, and the Western Pacific, also reduced financial hardship since 2015. Global progress in service coverage index has been driven primarily by infectious disease control, accounting for about 52% of the increase in the service coverage index since 2000. In contrast, reproductive, maternal, newborn, and child health services stagnant in the recent years at 72 index point, while care for non-communicable disease has lagged, reaching 61 index point in 2023. In 2022, 3 out of 4 people among the poorest segment of the population faced financial hardship from health cost, compared with fewer than 1 in 25 among the richest. Financial hardship from health expenditure also varies by age, household composition, and place of residence. Rural population experience a median hardship rate of 14% higher than the urban population, and people in multi-generational households, especially those with adult over 60, faces greater financial strain. So, a status of universal healthcare in Pakistan. Pakistan has expanded universal health coverage to an additional 51 million people over the last decade, from 87 million in 2015 to 138 million in 2023, according to a joint global report launched by WHO and the World Bank Group ahead of Universal Health Coverage Day 2025. On the occasion of UHC Day 2025, marked under the theme of unaffordable health cost, we are sick of it. WHO praised the government of Pakistan for the progress made over the past decade in collaboration with the WHO and the partners. WHO and the World Bank indicate that the Pakistan increased its service coverage index from 40 in 2015 to 56 in 2023. Intensified concreted efforts will be required to meet the global target of 80 by 2030. So we are still far behind from the 2030 target, but yes, we have made a significant progress over the years. Despite progress in 2024, over 14.8 million people still face catastrophic health expenditures, and 11.1 million people were pushed below the 2.15 per day US dollar poverty line across due to out-of-pocket medical cost. According to the most recent estimate of the Pakistan Universal Health Coverage Monitoring Report, which is compiled by the Ministry of Health in collaboration with WHO and British High Commission, Pakistan, UK Foreign, Commonwealth and Developmental Office. So this map is basically showing the universal health coverage service coverage index according to the 2021 data, and again the 0 shows the worst progress and 100 shows the best progress, and again it is measured across those 4 indicators of RMNCH, infectious disease, non-communicable diseases, and service capacity. And we can see that most of the developed countries, they have the UHC index about from 80 to 90. While Pakistan has its score around 56%, while India has a better score, still better score than us. This diagram is again showing the healthcare coverage by the level of healthcare is expanding. And we can see that United States and most of the developed countries, they are spending more on UHC, and that is why the UHC coverage index is more than 80 in those countries, while the countries like India and Pakistan is still spending less than $200, and that is why the score is again less than 56%, and India is spending around $450. and the score is between 60 to 80. So we know we can see from this diagram that as you increase spending on healthcare, universal healthcare coverage, so the UHC service coverage index ultimately increases. So as of 2023, the overall status of UHC index in Pakistan is showing signs of improvement, although a relatively slow pace. It is important to note that the progress towards achieving UHC varies across different regions of the country. The slow increase in the UHC index highlights the need for continued commitment and focused intervention to ensure that all citizens can access essential health services without facing financial hardships. So this is the chart which is showing the national and divisional UHC index result from 2015 till the end of 2023. So this diagram is basically showing the progress of all the provinces in Pakistan over the years from 2015 to 2023. And we can see that all the provinces have made a significant progress over the years, and their score have collectively increased over the years. So if we talk about Punjab, so the score has improved gradually over the years from 40.6 in 2015 to 55.4 in 2023, and same goes for all the province, and which ultimately lead to the average score of Pakistan to increase from 39.7 in 2015 to 53.9 index in 2023. So WHO response, the World Health Organization reaffirmed its commitment to the work with Pakistan and its people to expand the access to healthcare for all, no matter where they live or who they are. Despite progress, access to healthcare remain unaffordable for millions of people. The WHO states that no one should be forced to choose between providing life-saving treatment to their daughter or their son because they cannot pay the medical bill. Today and every day, WHO will stand with Pakistan and its people to build a healthier future for all. WHO will stand with Pakistan and its people as they address ongoing challenges and continue expanding access to basic health services with a particular focus on the most vulnerable as a priority to achieve the 2030 agenda and its SDG goals. So now we will see what are the universal health coverage programs being covered in Pakistan. The first program is Prime Minister National Health Program. So Prime Minister National Health Program is a milestone towards the social welfare reform, ensuring that the identified underprivileged citizen across the country get access to their entitled medical health care in a swift and dignified manner without any financial obligations. Prime Minister's National Health Program's objective is to improve access of the poor population to a good quality medical services through a micro health insurance scheme. So this is basically the treatment packages which are being offered in Prime Minister National Health Program, which is also known as Wazir-e-Azam Sehat Card. And it initially gave a coverage of 60,000 to per family per year, and the priority treatment in which the patient gets the 4 lakh per family per year. So a feedback was also attached to the success of this program, and it states the beneficiary satisfaction based on the third party feedback survey, and we can see that almost 96% of the beneficiary, they were satisfied with the treatment provided by this program, and 98% were satisfied with the hospital services, and 98% beneficiaries were also stated that they were not asked to pay for the services during the treatment. So overall the coverage of this program is very good. The next program is Sehat Sahulat program. The Sehat Sahulat program is basically a government health insurance program. It targets poor and vulnerable families, and it is a government funded health insurance, and it gives coverage to the major hospital treatments like surgery, maternity, cancer, and dialysis, while it does not cater OPD services. The type is basically it is for poor and vulnerable families, and access is done through CNIC based verifications. So Sehat Sahulat Program, or SSP, is Pakistan's main health insurance initiative to support universal health coverage in Pakistan. The main objectives are again to reduce out-of-pocket health expenses, prevent medical poverty, and improve access to quality healthcare and promote equity in health services. The achievement of SSP is that it increased access to hospital care, financial protections for millions of families, and better use of public and private hospitals. While again, the limitations of this program is limited outpatient coverage, funding and sustainability issues, and awareness gap in some areas. So this diagram is basically showing a brief comparison of the Prime Minister National Health Program and Sehat Sahulat Program. Both are government health insurance program. Both cater the poor and vulnerable families and provide major hospital treatment, and which is basically free. The major difference is that that Prime Minister National Health Program was the founding program for starting UHC insurance system in Pakistan, while the Sehat Sahulat program expand this UHC coverage basically on the provincial level. Coming to the strength of universal health coverage, again, it improves access to healthcare. It gives financial protection. It provides better population health, reduces in health inequalities, stronger health system. It leads to support for economic growth. It provides better emergency preparedness, and it causes the promotion of human dignity. While the challenges are there in implementing and achieving universal health coverage, the first and foremost challenge is the limited funding. Insufficient funding spending leads to the poor services and high out of pocket cost to the people. Shortage of healthcare workers, lack of trained staff, especially in rural areas, reduces access and quality of care. Weak infrastructure, again, inadequate hospitals, equipment, and laboratories delay proper diagnosis and treatment. There are urban-rural disparities. Better facilities in cities and poor access in villages create healthcare inequalities. There are governance issue, poor management, weak monitoring, and corruption reduces system efficiency, and rising cost of medicine. The change in price or the high drug prices make the treatment unaffordable and increase financial burden. So the Universal Health Coverage Day is basically celebrated all over the world every year on December 12th to raise awareness about the universal health coverage, and to basically raise awareness about basically raise awareness about the universal health coverage and to protect the people from financial and catastrophic out-of-pocket expenditures. Now it's time for the multiple choice question. The first MCQ is which approach best promotes equity in health, universal health coverage? A, equity, equal payment by all. B, free care for the rich. C, subsidized for the poor. D, high private fees. D, E, market pricing.
A.
C.
No, it is basically not equal payment. It is basically subsidized payment or subsidized services for the poor. The second MCQ is a country expand coverage without improving quality. What is the major risk? A, higher trust. B, wasted resources. C, better outcomes. D, lower demand. E, reduced cost.
B.
Yes, B is the right answer. It will lead to the wastage of resources. The third MCQ is which strategy best improve the sustainability of universal health coverage? A, donor funding only. B, text-based and pooled financing. C, user fees. D, charity hospitals. E, private insurance.
B.
Yes, B is the right answer. You need the coverage cube indicates that the center of the cube is basically for the text-based and pooled financing so that you can reduce the out-of-pocket or catastrophic health expenditure to the people. The fourth MCQ is why it's universal health coverage considered an investment rather than a cost. A, it increase taxes. B, it reduce employment. C, it improves economic productivity. D, it limits private sector. E, it increases imports.
Darling.
Yes,
C.
C is the right answer. It improves economic productivity. The fifth MCQ is a country invest in telemedicine for remote area. Which universal health coverage challenge is addressed? A, governance. B, rural urban gaps. C, medicine supply. D, corruption. E, funding.
Beta.
As per my key, the right answer is funding, because it says that a country invest in telemedicine for remote areas. For obviously, you need a lot of spending for this system to expand. So it basically challenging the funding component of the UHC. The sixth MCQ is a nation with strong primary care, insurance coverage, and emergency system manage COVID-19 effectively. This shows that UHC improves A, hospital profits. B, political stability. C, system resilience. D, private investment. E, drug import.
B.
The right answer is C. It shows the resilience of the system, because the COVID-19 was an emergency or basically a disaster. So if the system has efficiently manage to cope up with it. It shows the resilience of the system. Seventh, a health insurance system scheme exists, but hospital refuse patient due to delayed payment. Which system weakness is responsible? A, poor governance. B, lack of awareness. C, population coverage. D, infrastructure gap. E, workforce shortage.
D.
The right answer is A, poor governance, because there is the insurance system is there, but there are payment issues between the companies and the government. So it basically shows the governance issue or the gap in governance. The eighth MCQ is: a country provides free hospital care but ignores prevention and screening. After 5 year disease burden increases. What caused this failure? A, poor financing. B, weak primary healthcare. C, low insurance enrollment. D, high medicine prices. E, staff migration.
A.
B.
The right answer is B, weak primary health care. The ninth MCQ: a woman avoids antenatal visit because transport and medicine costs are too high, even though the services are free. Which universal health coverage principle is violated? A, quality care. B, financial protection. C, service coverage. D, equity. C, E, sustainability.
B.
Yes, B is the right answer. The last MCQ is: a government introduces free health card, but most rural hospitals lack specialty and equipment. What is the main barrier to UHC here? A, financing. B, awareness. C, insurance coverage. D, infrastructure. E, policy.
D.
Yes, D is the right answer. It is the lack of infrastructure. This is the key to all the MCQs. These are the references which have been used in my presentation. This is the official YouTube channel of the Institute of Public Health, where the recording of this presentation will be uploaded. And thank you for your patient listening.
Thank you very much, Dr. Ayesha, and I am sure that everyone has learned something from this presentation. Please, if you stop the recording, I want to